School children who are close contacts of COVID-19 cases would no longer have to self-isolate for 10 days if they show no symptoms, under changes being considered by health officials at NEFIT. That is according to reports in the Irish Times today. Currently, there are 14,000 school students out of school as close contacts. And for more on this, we're joined by Professor Jack Lambert from the UCD School of Medicine. Good morning, Jack. It strikes me as they're going to have to rework the criteria here for putting kids out of school. 14,000 students is simply too much, considering the vast majority of them are at low risk of becoming seriously ill, and indeed in the majority of cases are actually asymptomatic.
Yes, well, absolutely, but that's a lot of kids, and if you look over the last couple of weeks in terms of the numbers of cases reported by the government, like they keep on saying, kids are not a source of transmission, kids aren't catching it in school, but actually 50% of all cases in the last 2 weeks were 25 and under.
Okay. Are you
20% were 12 and under. So kids are spreading the virus. Kids are spreading it. And the issue is that do we let them spread it because they're taking it home, and it's having consequences for the whole family, including people who are at risk in the home. Or I think we need to live a living with COVID strategy for schools that, doesn't keep kids out of school, but makes it safe for everybody, both in the school and in the household, to safely.
I think what's being discussed and what's being said, Jack, is that children were due to stay out of school for 10 days in the early stages of the pandemic because of the fear that they would bring home from the school COVID-19 to vulnerable adults at home. But with in excess of 90% of the adult population vaccinated, that risk is so much lower that the risk of them being out of school in terms of their education, their socialisation and their development, etc., that those risks now need to be balanced. Is that a fair assessment?
Absolutely, it is a fair assessment. I do agree with that. But nonetheless, we keep on saying 90% vaccination means we don't have to worry about COVID anymore. That's absolutely wrong. We're still getting patients admitted and staff infected with COVID who've been double vaccinated. So the vaccines help, but they're not the only solution. There's a lot of COVID mitigation strategies that we need to continue to kind of support as part of the solution.
So what would you like to see happen, Jack, with regard to school children? Because obviously it is not ideal that they would be missing maybe, 10 days here, there and everywhere throughout the school year.
Yeah, no, I absolutely agree. And it's not just the kids being out of school; it's the whole family. And the parents and stuff having to not go to work and the consequences of that. So look, I don't have all the solutions here, but the reality is, I think first off, are the schools well ventilated? Is everything in the school to minimize the risk of COVID transmission? Number one, I think masks have a role. And then I think all of, and then testing has a role as well. We've talked before. Other places have done testing as part of the solution. And if
are you talking about antigen testing here?
Yeah, absolutely. So I think we other countries have successfully used antigen tests as part of the strategies. Other countries have used masks, even in, I'm not saying use masks 100% for every kid in the school situation, but if we have a healthcare worker who's been exposed, we can't keep them out for the 10 to 14 days because we don't have the manpower, but we're looking at testing, we're looking at using masks and enhanced masks in the hospital setting. We have to think about solutions like that moving forward, because we're going to continue to have outbreaks all through the winter in all school populations, because they're the people who are getting the infections. Look at the number.
Look, thank you for speaking to us this morning. That is Professor Jack Lambert there from the UCD School of Medicine. I think Jack is actually absolutely right, Shane. I don't think that we can continue to put kids out of school for that length of time on an ongoing basis. It's not good for them. And I think there are cleverer ways to manage this than we're currently, I suppose, operating.